Welcome to DC to Be Revolution, helping chiropractic students think big in order to live large. I'm your host, Noah Volz, and today I'm here with Dr. Erik Reis. Did I pronounce your name right? I forgot to ask you before the show started.
Yep, that's perfect.
Okay, awesome. So he holds a doctorate in chiropractic medicine and is a board-certified chiropractic neurologist at Minnesota Functional Neurology and Chiropractic in Minnetonka, Minnesota. He believes that the connection between neurological function and nutritional status is essential to understanding how to fully maximize brain and cognitive function, which I definitely need since I'm in school right now. And he also takes a multifaceted approach to improving brain health and overall wellness. So Dr. Erik, thanks so much for being here.
Yeah, thanks for having me. I'm excited to be here.
Yeah, I'm excited to have you on the show. And so, I just wanted to jump right in and have you talk a little bit about how chiropractic and manual therapies can change the integrity of the brain, change the integrity of the body and the musculoskeletal system. What's the connection there that students need to be aware of?
Yeah, I mean, it's a great question, and I had the exact same question when I was in school too. Being an athlete for my entire life, playing hockey and soccer, sustaining sports injuries, having concussions, all that stuff really aligned with me. And when I got to chiropractic school and started learning about anatomy and physiology, and then even more importantly, neurology, I really had a lot of questions that I didn't have answers to. And so I started going down this route of really trying to discover what else we've got going on. And when it comes down to it, every practitioner and every individual in society really is interacting with the brain. You're having conversations, you are making connections. As a therapist, we're looking at ways to, quote unquote, update someone's software, whether that means getting them out of pain, getting rid of specific ailments that they're coming to you for. So when you take a look at the brain, our brains are really old. Our brains were essentially there to help us keep us safe and to promote our genome, right? They weren't designed to keep us happy. They weren't designed to have us make $1 million. They weren't designed to do any of that fun stuff that we all want, right? So when you take a look at what the brain does, it really is a big superpower computer. And it takes in all this information from muscles and joints and skin and vision and hearing and puts it all together, processes it, and then puts out some algorithm. Now, whether that's you seeing a puppy and having a really good emotion, or whether that's you seeing another Scantron sheet and being like, oh my gosh, this brings me back, horrific memories of chiropractic school. All those things have to be processed by the brain. And that's essentially where a lot of my studies went when I was in school. Go have a conversation with a cadaver that has all the muscles, all the joints, all the tissues, and all the organs, and you're not going to get very far because they don't have an intact nervous system. And when you take a look at the foundations of chiropractic in general, we've all been trying to affect the brain in some sort of fashion. Now, whether or not that's our genuine goal is a different conversation, right? We're looking at segmental dysfunction or looking at muscle tone, different aspects of how we want to, quote unquote, measure things within chiropractic. It all comes down to the brain. And so for me, I went down that route. And the further down the rabbit hole you go, it's like Alice in Wonderland, the more questions you have. And the more that you really understand that the less we really do know. I mean, the brain really is the final frontier. And so going down the neurology route has really opened up a lot of doors and a lot of insights into how I perceive different therapies. It kind of gives me a better idea as to why a lot of things may work and why a lot of things may not work, even if they're in the same realm or if they're the same technique. And the beauty of neurology is that it's not a technique. It's a philosophy. It is a roadmap for me to try and make very educated assessments and assumptions, test them in the office, test them clinically, and see if I can benefit the person in front of me. And so whether that means I'm doing a chiropractic adjustment, whether that means I'm doing soft tissue modalities, whether that means I'm assessing the eyes and the visual vestibular system for balance and stability, all these things come together in the brain. And that's what my main focus is to say, what's going on with a patient's brain that's sitting right in front of me, what's working well, and then what isn't working well. What can I try and do to make the systems that aren't working well to function at a higher level, right? What technique, what modality, whether that's, like I said, an adjustment, it could be soft tissue, it could be nutrition. Heck, sometimes it could even be talk therapy, right? Everyone's got a cortex, everyone's got a frontal lobe for the most part, right? And so these things are all important for brain function. Now, things get a little complex when you say, oh my gosh, there are so many things to look at. There are. Humans are complex. How can we, we all have anecdotal evidence about different aspects of manipulations or modalities affecting areas that we may or may not have assumed that they would. It's not saying that those are wrong, but there's something there that we haven't uncovered yet. And to me, all of that comes down to brain function, whether that's integration in the spinal cord, various aspects of the brainstem, the cerebellum. All these areas are important for us, and we know that. If you take a look at some of the work that Heidi Havoc is doing over in New Zealand, she is trying to uncover some of these areas within chiropractic. Now, the difficult aspect with that is just because we change some frequency of firing in the brain in the frontal lobe with an adjustment, as some of her studies have found, or we change some sort of integration, it doesn't necessarily say that that's for better or for worse. And so in my office, when I'm doing things with patients, my goal is to try and see if I can make them change consistently over time with specific modalities. So for instance, let's look at balance, right? Classic Romberg's. Does somebody's balance get better after an adjustment? Cool. Well, what if it did? Well, let's try it again next time. What if it didn't get better that time after an adjustment? Well, does that mean you gave a bad adjustment? Maybe. Maybe you just got really lucky on the first one. Or maybe they needed something different that you changed their brain before, and now they need something different on the next stage. Those are things that we don't know. Those are things that I try to uncover with my patients. And like I said, there's not a specific technique or modality that I get to choose from. I have the luxury of choosing anything and everything because I know that they're all going to have some effect in the brain. And that's my goal in the end, is to try to affect the brain in a positive way, consistently, long-term, over time, and to educate patients and individuals to be able to do things on their own, eat well, think well, and move well. And that's essentially the basis of what I'm trying to accomplish in my office.
Yeah, and we all want that. We all need that. I really appreciate how you talked about neurology not being a technique, but in a way, functional neurology is an assessment tool that you're able to utilize to figure out what areas of the brain are working well, what areas of the brain are not working as well. And then, like you said, the field of neurology, there's still so much that we don't know. And so you've done the due diligence, going down the rabbit hole, figuring out what people have done before you to change these different areas of the brain that aren't working well, trying that with your patients and figuring out what's working, what's not working. But like you said, it's so complicated. There's so much going on. So, I know for me as a student and many other students I've talked to, they get kind of scared of how complicated it is. Sure. Have you developed any sort of system that you utilize, or kind of a sequence that you utilize to minimize some of that complexity, but still allow you to have the complexity in terms of your treatments?
Yeah, and that's a great question. I think no matter what anyone would tell you, we all have a system that we kind of operate with. We all kind of have to have that roadmap, right? So when you're in school, you're learning how to adjust, you're learning how to assess, you're getting inundated with these different techniques and philosophies and what people have done in the past and what's worked well for them. You kind of start figuring your own thing out. You can't argue about the fact that we have to be really good at assessing the structural system, right? That's inherently what we've been taught with chiropractic. The beauty of that is we've also been taught to critically think. And so when it comes to that component, you got to be able to assess people structurally. You have to be able to assess people metabolically, right? So understanding how important inflammation is, the gut biome, all these different aspects that can really change structural and neurological function. And you also have to be able to understand the neurology as well too. Now, it is complex for the most part, but there are ways that you can minimize your ability to get caught in that game, and that's by repetitively getting better and better at doing an examination, by going through, by working on people. And the biggest thing really is understanding what normal looks like. Now, we can argue all day what is normal, right? And even if you ask me, some days I think I know, and then other days I have no idea. But when you know, for the most part, what normal looks like, you can start seeing things that may not look normal. And when you see things that may not look normal, you can start further investigating those things. I don't do a full, complete cranial nerve exam on every single patient that comes in, and it really wouldn't be warranted for somebody who may have like a really big disc issue, right? But could there be something that I find? Maybe. Could that maybe affect their brain or their physiology or their function? Maybe. I don't know, right? But you can't expect somebody to do a 2.5, 3 hour complete neuro and structural examination on every patient, because you'd never make any money. You'd never be able to pay your student loans back. And to be honest with you, would be really inefficient. So there are different paths that you have to take. And once you start understanding normal, looking for things that are abnormal, you can start investigating. And that's kind of the same thing with chiropractic, what we're taught in school too, right? If you get negative orthopedic findings, well, I hope you did it right, first of all, right? Because if you got a negative, that doesn't always mean that it's a true negative. But you're not going to search and continuously go after things that may not show up. And so you're going to go down that thought process, that logical thought process, to investigate and look through all these different areas. Far easier said than done. Completely understand that, and I'll be the first to acknowledge that. But when you get more acquainted with brain function and a lot of the traditional, ways to assess the brain, which is looking at the eyes, which is looking at the vestibular system, looking at musculoskeletal components, all these things have one thing in common, and that's the brain. So putting those together and correlating them, it will give you more of a window to understand what's going on. Once you kind of understand more integrative wise as to how different things play a role. So for instance, right, the eyes and the cervical musculature and your balance, right, heavily integrated with each other, right? So as a viewer, I challenge you, put your fingers on the back of your skull, right below the base of the skull, on your suboccipitals. Don't move the neck, okay? But I want you to move your eyes around all over the place, okay? Now, if you're palpating hard enough, you're palpating in the right spot, you're probably going to feel neck musculature fire back there, right? So we know that the suboccipitals, the neck, and the eyes are heavily integrated with each other. If you have a patient that comes in with chronic, consistent neck pain, and they've seen all the docs, you've tried the modalities, they just really haven't made the change you wanted, maybe you're missing something. Maybe there's something visually that's going on that's manifesting with neck pain that they could benefit from by you doing some visual integration exercises with different types of head movements, neck rotation. You're integrating the eyes, the musculoskeletal system, and then the vestibular system in the same modality. Now, that doesn't mean that you've found the hidden gem, right? But that could be one of the things that could cause you to look down that path, that could give you more of a window or an opportunity to get somebody to improve in functionality. So although that's kind of a long-winded answer and totally like a doctor cop-out, response that I have, I've perfected it, I guess. When it comes down to it, I got to look at everything. And I look at the metabolic system, the structural system, the neurological system. If I see things that I don't think look right, I'm going to investigate them. And I'm going to try things. Even during my examination, when I'm examining somebody, if I have somebody who has a convergence insufficiency, I'm going to try and see if I can work on that convergence insufficiency and maybe look at balance, maybe ask them for some subjective changes in neck pain or tension or range of motion. I'm looking at those things because I want to know clinically what may work for them. And if that does, I set myself up to give them exercises. The best part about it is that they kind of experience that firsthand. I didn't just take a shot in the dark and say, well, I think you're going to do well with this exercise. I want to know, because I want my patients to get better as fast as possible. I want to give them that independence that they want and that they deserve. And I want to get them out of my office so they can live their life. And I hope that when things go down in my life at some point, somebody has that same philosophy to help me out, because I want to continue to do things that I enjoy in my life and not spend any more time in a doctor's office than I need to. Very different concept than saying you want to be someone's doctor for life and being available for them. I tell people I'm not going anywhere anytime soon, right? But that doesn't mean I want you in here every single day, because you got to be able to live your life and do the things you want to do.
Yeah, and I feel like that's the goal for every chiropractic student, every
Totally.
chiropractor is really to help people. And
Yep.
I really appreciated the way that you put that. You mentioned early on that we developed a nervous system to keep us keep ourselves safe. But really, a nervous system is just a tool to observe the world and interpret the world. And really, what you were speaking to is how you have developed and your nervous system to do these very specific tasks that have to do with neurology. And so in chiropractic school, of course, we develop our hands and our ability to touch, tone, and feel motion and stuff. But you've gone and developed this additional skill set where you can see eye movements, you can notice cervical musculature, all of these other kind of observational tools. And I feel like in a way that reduces the complexity, because really you're just developing your tools of observation, and like you said, figuring out what normal is, figuring out what abnormal is, and if you see something that's abnormal, trying to figure out the tool that will help with that. So I wonder if you could tell a story of maybe somebody that you, of course, not violating HIPAA, but a story of somebody that you've worked with or that you really enjoy working with.
Yeah. I have so many good stories that I could talk about, I guess. But one that really sticks out with me was I had a patient a while ago who had a lot of chronic dizziness. He's been to all the docs. He's been assessed by a lot of really high profile individuals in all aspects: chiropractic, physical therapy, MD, neurology, you name it, he's seen them. And his biggest issue was that anytime that he turned his head one way, or he drove and had cars passing him in one side of his visual field, he'd get dizzy, right? So he's been looked at for BPPV. He's looked at for all these different things that classically we want to say, oh, we want to fit you into a category and give you a label, right? Well, he didn't get a label. And so he made his way into my office. I took a look at him, and he told me in his history what triggered his symptoms, right? Anytime he turned his head in one direction, or anytime some peripheral visual input went past his eyes and included some sort of sensory input into his system, right? So what I did was I assessed him, and I found a couple different areas that weren't working well, a couple of things where he wasn't tracking well, right? He wasn't doing very well with the things that he told me. Visual inputs coming from one specific side, neck rotations, right? So what am I integrating with all that? Well, I'm integrating the eyes, obviously. I'm integrating some sort of visual vestibular, so that's the eyes and the inner ear combined together. I gave him exercises based off of that. And we started it out small with him just looking at static targets, doing like no-nos, yes-yeses, different types of aspects that integrate the otoliths and the semicircular canals together into that lower brainstem. And so we started working it up, and we started making it harder and harder and harder. And then we started working on his balance while he was doing things like that, and integrating different types of stripes and movement. They're called optokinetics. We'd give him these exercises, and over time, what he was doing is he was realizing that he wasn't as sensitive to these inputs. And at the end of the day, we were actually able to completely eliminate all of his dizziness because of the fact that not only did I listen to what he told me in the history, he told me my treatment plan. I just got to get this guy to be conditioned to be able to handle those inputs, right? And it's the same thing for anybody who does musculoskeletal work, right? If you've got a weak biceps, you're not going to train the triceps or the quad or anything else. You're going to go after that biceps, right? You want to have muscular hypertrophy, but also neurologically, you want to build the integrity. The first 6 months of any workout are actually changes within the central nervous system. And then after that, you start actually getting genuine changes in the tissue. Now, to a point, I'm sure that there's changes in the tissue going on. You're going to have breakdown and catabolic and anabolic mechanisms at play. But with him, what we did is I built him up, and I tried to get him to be able to handle those stressors. And over time, he did really well. Now, can I say I can take every single person's dizziness away? No matter how badly I would like to. But what I did is we went through and checked every single thing that we could with him, and I gave him exercises based off of how he showed me the outcomes with that. And he did really well. Now, the other interesting thing with him too is that He also had a couple other things going on metabolically that we addressed. So he was chronically inflamed, had a chronic viral infection. And so what we did is we placed him on an anti-inflammatory diet. Not saying I can take away viral infections immediately, but what we did is we dampened some inflammation down, helped his nervous system be able to adapt effectively, and he did really well. Now, I haven't seen the guy for a couple months now, which is great because I was able to do exactly what he asked me, and that's just to give him his life back. And as he told me, he likes to drive cars fast, and that's all he wanted to do. So I was fortunate enough to be able to have that, but that didn't come without making mistakes. Checking out different types of exercises, therapies, things like that. There's a reason why they call it clinical practice. And for the students out there who listen to podcasts or listen to docs talk about different therapies and techniques, they didn't get there immediately and not make any mistakes. I've made far more mistakes than I've had successes, and that's what's gotten me to the point of my career. And I think anybody who's been down this road will tell you that. Now, I've been fortunate to have mentors and people to surround myself with who've helped guide me along the way and help me avoid making some bigger mistakes. But you got to be able to make mistakes. But the biggest thing with that is you have to learn from it, and you have to make sure you don't make the same mistake twice. And I think that is what can carry over. And fortunately enough, I was able to help that patient out with his dizziness. And, you know, that was a really good result that I fortunately had the ability to affect structurally, metabolically, and neurologically together in one specific modality or one specific treatment session to help him improve his nervous system.
Yeah, thank you for sharing that story. And, you know, there's so much there. I really appreciate how, you know, he came in with dizziness. Everybody was treating him for the dizziness. But what I'm really hearing from you is you treated him as an individual based on the historical information that he was giving you, and really addressed, you know, him as an individual, because you could say that you treat dizziness, but every individual's dizziness, the cause is going to be completely different. But with your knowledge of the nervous system, you were able to really, you know, drill into that. And you know, what I really like about what you're saying is I feel like if you're not making mistakes, you're not trying anything new, because you know, you can do the same old thing and never make a mistake, but are you actually learning? Are you actually growing? And so do you have any sort of system or method that you utilize in terms of, you know, bringing new modalities, bringing new research into your practice and integrating that so that you can, you know, continuously help more people?
Yeah, you know, that's a great question. And, you know, I would be lying if I said no, because I do new things every day. And early on in my career, I made a promise to myself that if I'm doing the same exact thing with patients 6 months from today, I'm really not maximizing my skill set or their ability to get better. And the cool thing with neurology and neuroscience is that there's so much information coming out about the brain, the eyes, the body, and even more importantly, the gut, metabolic systems, how, you know, nutrition plays a role with neurological function and how that can manifest structurally and musculoskeletal wise. I mean, every person that comes into your room, they're one human with one body and one brain, and you have to understand that concept, and you have to treat them that way. And no one person is alike. So every treatment that you have, every modality that you use, has to be used in a different manner specifically for that individual. We know cookie cutter approaches haven't worked in the past. They haven't worked for us today, and they probably won't work in the future. So why are we stuck in that model? I have yet to find that out, but I know that there are people out there who are trying to change the game, and those are the people that I want to associate with. And those are the people who I find on social media. Those are the people who I follow, who I read their lectures, I read their posts, I read their information that they post. A lot of my social media is essentially my ability to find new research, new papers, and connect with colleagues who are doing cool things like that. You know, there is a reason why they call it clinical practice, and that's because when you acquire new information, you have to try and see who it works well with, or if it works at all, right? Just because something was published in a journal does not mean that it is concrete, it is a law, and that's all that is said to it. We know that very well traditionally, that there's a lot of stuff that has to be either rebooked or we know that it's been disproven. And if you're practicing the same way you were 5-10 years ago, not only are you behind the ages, but some of those practice guidelines are malpractice, not only in chiropractic, but with traditional medicine. Taking a look at prostate screen, breast exams, different types of diagnostics that we used to do frequently that have now changed. So the same parameters I try and hold true for myself with doing rehabilitation, with doing nutrition, brain-based therapy. All these things have to be evolving, and I don't know everything. Right? I'm the first to admit that, and I'll be the first person to admit if I think I can help somebody get better, I'm going to try and do that. If I can't help get them better, I'll be the first person to let them know that too. But what I'm going to do is I'm going to find somebody who I think can actually help them, and that's why it's so important to have colleagues, not only colleagues within the chiropractic profession, but MDs, PTs, OTs, people who have different skill sets who can challenge your beliefs, your biases, and your thought process to get you to think a little differently. So when I hear of something new, or I try something in the office, or I find something that I have a lot of questions about, I'm not scared to reach out to people to have those conversations. I'm also not scared to try it with patients. And patients know that, because some of my best outcomes have been where we've tried something new and a patient has finally responded to it, and there's no specific way that I could have foreseen that besides just trying it. It's scary at times, but once again, anyone who's been successful in life will tell you that they've just made a lot more mistakes than everybody else, and that's why they've gotten to that level of success. And a mistake is something that has to be calculated, right? I'm not going to go jump off a cliff and hope that I adapt and grow wings on the way down. That doesn't make any sense from a logical standpoint. So why would we do that clinically? Well, let's make educated guesses to make an assumption or test a hypothesis as to what might help somebody. Let's implement it. Let's make sure we have either an objective or a really good indicator to test pre and post your intervention, and let's see if it helps them out. And that's just what I try and do in my office. I'm not perfect, and like I said, I don't know everything, but I continuously trying to challenge my belief and my skill set with applying those things clinically. It's what's gotten me here today, and hopefully it will be what kind of carries me through the rest of my career to hopefully be a successful one.
Yeah, I mean, using the scientific method is such a great way to do that. And, also talking to your colleagues, seeing what other people are doing, hopefully somebody has already tried what you're planning to try and can kind of walk you through like, oh, that's a great idea, or no, that's a terrible idea. So having that community within chiropractic is so important for you to progress, and to avoid making, some of those mistakes, and then the ones you can't avoid, you make them and you learn from them and you grow through them. Agreed. So, I think that's really important. I know that students and chiropractors are going to have more questions. They're going to want to know, more about how they can have more of the scientific method in their practice. What's the best way to get in touch with you or learn more about what you're doing?
So I'm always open for conversations. My patients know this, colleagues know this. I'm an open book. So if anybody has any questions about what I'm talking about, my education, what I do in the office, they can always just feel free to email me. And that's my email address is Dr. Erik Reis. So it's just Dr. Erik Reis at gmail.com. I'm on Facebook, I'm on Twitter, I'm on Instagram, and it's the same thing, just Dr. Erik Reis. No, I'm sure you'll post some links attached to this too, but reaching out to me on one of those platforms is super easy. You can also find me at our clinic website. That's mnfunctionalneurology.com. There you'll find more information about what we do in the office, why we do things, and more importantly, why we do things differently. We're just continuously trying to challenge that status quo of not only healthcare, but how we treat patients, why we treat patients, and what is the end goal at the end of the day. It's to give people their lives back. The quality of life is something that I always have in the back of my mind, because that's what's most important for people. I don't want to live to be 100 and be debilitated for the last 40 years of my life. I want to be able to do the things that I enjoy, spend time with my family and friends, and just really enjoy what life has given me. And so it's always in the back of my mind, and I'm always open to having conversations with people about that. So like I said, any of those links will be easily accessible for me. I'm on LinkedIn as well. You shouldn't really have many issues finding me on any of those platforms. Yeah, perfect. Then I'll put that in the show notes. And thank you for saying that about the status quo, because I feel like that's really the reason I created this channel, DC to Be Revolution, is because I want to
the status quo isn't working. People are not healthier than they've ever been before. Maybe they're living longer, but their quality of life has really decreased over time. And chiropractic has always went against the status quo, always been pioneers, always been innovators. And so it's so great to talk to somebody like you who's really, taken that to heart and really making the most of that so that you can get the best patient outcomes for the people coming in your doors.
And I think a lot of that really comes down to effective communication. I think we need to have conversations about things that we agree on, but more importantly, things that we disagree on. We need to have conversations, and it's okay to disagree on things, but we really need to challenge even the status quo within our profession. Every profession has it. We need to grow. We need to change. We need to adapt. More importantly, we need to get people in front of the community, in front of those individuals who need to hear the message, and to educate the population and the individuals who really need our help, to let them know that not only are we out there, but we're out there for the right reasons. And that's always been a big passion of mine, is just to be an effective communicator. And in any organization, communication is key, whether that's a personal or professional relationship. I would love to see more people getting out there, opening up, giving quality content, and following up in the footsteps of essentially what you're doing, is getting individuals to have those conversations and project it to the world. And the beauty of living in 2017 is I don't need to be in the same city as you for us to have a conversation, or for us to affect millions of people who may not be able to meet us personally. They can meet us online, or they can hear our message via the web.
Yeah, exactly. And that really is the goal of this channel. So, thank you so much, Erik Reis, for being a part of it. Really great to have you on the show.
Yeah, no, thanks for having me. I enjoyed it. And I wish you the best with this. This is a great platform. I'm excited to see where this goes.
Yeah, thank you. So this has been a production of DC2B Revolution, helping chiropractic students think big in order to live large. I'm Noah Volz. And if you like this video, please consider subscribing to the channel. Support this video by sharing it with your friends, your family, people you think who can benefit from this information. And like Dr. Erik Reis said, let's spread this message. Let's create more conversations, and let's become a broader, bigger community of individuals who are excited about chiropractic. So thank you once again.